My name is Cameron Rodriguez. This is the Advanced Health class in F Block, and today's topic will be about the careers of administration and nurse care manager. And this is my tia Grace Henriquez, and she is a registered nurse, and she's a nurse care manager, and she's been in business for many years. And yeah. So, what's the name of the health care?
I'm a registered nurse. The career is nurse care manager. We oversee care of elderly patients, brain injured patients. We oversee the nurses and home health aides and all the ancillary services that a patient may need.
So it's administration.
Yes, I'm a supervisor and I coordinate the care.
Okay. And how many years of the medical school or college that you need to become into this health?
Well, I'm a registered nurse, and you can become a registered nurse through a community college. You can get an associate's degree, which takes about 3.5 years. There's a bachelor's program, there's master's. For me, I have an associate's degree, and then to be a nurse care manager, you have to have at least 5 years experience, and then you have somebody mentor you, and then you can start overseeing care.
And when did you start your business?
About 15 years ago. But I have been a nurse since 1983, so almost 30 years.
Okay. And what are the types of courses and subjects that you need to take during community college to get your associates and other classes you need to take to pursuing this?
Well, you have to take anatomy and physiology. That's one of the first classes that you take. And that's to grant entrance into the nursing program. And then once you're in the nursing program, you take courses related to the entire body. You study cardiology, you study the respiratory system, you study gastrointestinal, you study pediatrics and psych, obstetrics, everything. So you do coursework in everything, in every segment of the nursing profession.
Okay. And what are the diseases and injuries treated by this profession?
I primarily specialize in brain injured patients, and they can be anything from a young person that's had a car accident. They're called TBIs, traumatic brain injuries, gunshot wounds. Sometimes it's patients that have had aneurysms. In the elderly, they're stroke patients, and I've had a couple of patients that have taken bad falls from buildings, like construction workers. But that's primarily what I specialize in, head injuries.
What is usually the age that is ranged in all of these?
Well, I have one patient that I have taken care of for 18 years, and she was in her 20s. She's probably one of the youngest ones I've taken care of. And then I have elderly people in their 80s.
Okay. And what are the type of equipment and instruments used in this career?
Well, I use my stethoscope and a blood pressure cuff a lot because that's something to evaluate blood pressure. So that's what I have here. For certain patients, because they're bedbound and they don't get to move a lot, they develop decubitus ulcers, which are bed sores. And so then we have to do sterile dressings. So you'd have gloves and 4x4 and whatever medication. If a patient needs IV medications, intravenous, then you would have syringes and IV bags and needles and all of that.
Okay. And with this health career, is it like complicated in some ways, and then the benefits, the cons and pros?
Well, it is very complicated. You have to have great organizational skills. As I said, many of my patients are very sick. They require 24-hour care. So I have to coordinate the caregivers to be there all the time. It's demanding, but the benefits are that you help somebody that really can't help themselves. So I believe that the benefits totally outweigh any of the negatives.
And then what do you supervise over, like with your company?
Well, I oversee the nurses, which is skilled care, and also the attendant cares. Again, with these kind of clients, they need people to help bathe them and take them to the bathroom and feed them, and that's called unskilled. Those would be the home health aides, the homemakers. The nurses actually provide the skilled care, which is wound care or checking vital signs, and I supervise and coordinate all of those disciplines and coordinate with the physicians to get whatever orders that we need for medications and treatments.
Okay. And also with this health career, is it hard for everyone else to like coordinate with the schedules and that you have to do this at this time and watching over and having everything get out of place? And
Well, yeah, it would be very difficult for each individual nurse and home health aide to manage that. That's why you need a care manager, and that's what I do. I kind of set their schedules, and we have communication logs so everybody can write whatever questions they have. And there's a lot of people coming in and out of a house, so absolutely it would be very difficult. But when you have one person and you implement communication techniques, I think it makes it flow.
okay, thank you so much for this interview.
Okay.
And this is the nurse care manager and administration, and that's all for today. Thank you for watching. And I'm Caroline, and then this is
Grace Henriquez, thank you.
thank you for watching, and thank you for letting me interview you, and have a wonderful day.
You too.